Well, October is used to observe breast cancer awareness across the world. Government says breast cancer among women is increasing. It says data shows breast cancer is more prevalent among white and Asian women and the second most common cancer among black and colored women. Early detection can lead to effective treatment and a positive prognosis. Well, joining us now to talk a little bit more about this is Dr. Samantha Baron, who is a geneticist, and Dr. Yashica Khalawan, who is a GP, and they're going to give us a little bit of direction and information with regard to breast cancer awareness. Ladies, fantastic to have you. Thanks so much for being our guests.
Thank you, Leanne.
Thank you so much.
It's an absolute pleasure. So let us start. I imagine the best place to start, Dr. Khalawan, is with you. What is it that, I suppose, is leading to this data that breast cancer is just becoming more and more prevalent? We try and educate, we try and get the message out there. However, it just keeps on growing. The figures keep on growing. What's happening?
So, Leanne, there's a number of factors that can lead to a woman contracting breast cancer. As Dr. Baron's going to speak about the genetic linkage. So there are certain factors that we can modify and there are certain factors that we cannot modify. So unfortunately, if you are going to contract breast cancer, sometimes there's not much one can do to avoid getting it.
So a lot of it is actually genetics based, and obviously Dr. Baron, this is where you come into it. So whether we want to avoid it or not, there are circumstances where we are almost just predisposed to get it, and that's the reality.
Exactly, yes. So in the case with the breast cancer, obviously a family history and a personal history of breast cancer plays a role. You have your gender, race and age, and then obviously being a carrier of a genetic risk mutation. So all of these factors would then play a role in that.
But I mean, is it almost a guarantee? For instance, take somebody like myself. If my mother, which thank goodness has not had breast cancer, but if she does have it, but her mother had it, is it almost kind of a very high possibility or probability that I will get it?
So it's very important to look at it in terms of a risk ratio. So your risk would be high, but it doesn't necessarily guarantee that you will get it. So I think, sorry, just to give you a bit of stats there. So if you do carry a genetic risk mutation, let's say in your BRCA1 gene, or what we normally refer to as the BRCA gene, you have an estimated 55 to 65% chance of contracting the cancer within your lifespan. So it's actually just elevating your risk, not necessarily making you, it's not a diagnostic. So it just increases your risk.
Yeah, which means that you have to be a lot more vigilant. Say, if you don't have it in your family history, someone who does have it in their family history or in their genes should be a lot more conscious about this and obviously do what we've been told to do. Test, self-examination, all of those things.
Yes, I mean, elevating our own awareness of our potential risk is really important. And I think, if we really increase our own awareness and educate ourselves, this will ultimately lead to earlier detection and improved outcomes.
If we have to look at sort of, I'm going to talk a little bit to the gene side of thing before we move onto the other issues and particularly numbers as well that are coming out. If we look at sort of a family history, where would we be looking? I mean, as a woman, do you look at your mother's side? Do you look at your father's side? Or do you take both into consideration? Because that's just the way it works.
So I think it's important to, so if you already know that your mom has breast cancer and she's already done a test like this and we've identified certain markers that put her at risk, we could then just screen you for those similar markers. If you have no idea which genetic markers play a risk for you, then we would want to screen both the mother and the father. I think it is important because obviously we do inherit alleles from the mother and the father. So screening both would actually be quite beneficial.
Yeah, which is quite an interesting aspect because I don't know if people actually look at sort of the father's side and go down the line there. You rather sort of look at your mother and say, well, okay, my mom, but I don't actually know what happened on my father's side, so you almost ignore that. But so when you say you can test for this, is this something that has become more common? Are people actually looking at getting their genetics tested to try and find if they do have a disposition to it?
I think in terms of other health aspects, yes. With breast cancer, we're obviously trying to elevate the awareness a little bit more with that genetic testing, because there's not a lot of people that are able or have access to such genetic testing yet. So obviously we would like to have this testing become more available to the general population. But in terms of other health aspects, there are a lot of other health and wellness and diet tests available for people.
I mean, there are some people, and I mean, I'll take quite a dramatic decision, and I remember this from a way back, well, not too many years back, was that of Angelina Jolie, who decided to go ahead and have I think it was a double mastectomy, and because she had the predisposition, so she thought, well, I'm going to go ahead and do this to prevent it. Would you say that's a little bit dramatic, even if it does come up as something that may be running in your family, that you may be predisposed to it, it doesn't mean that you necessarily will get it? Or is that one of the routes that you should go if, in fact, it is a high risk in your family genes?
So in my opinion, I think that's why the practitioner plays such an important role when it comes to this, because when we look at the genes, that is just one aspect. So it's not a diagnostic, as I mentioned previously, it's just determining a potential risk. So the practitioner would then obviously look at the patient and consider all controllable and uncontrollable risk factors. They would take the family history into consideration. They would take current lifestyle, environment, and all of that before they make a decision. So in some instances, it might be the right choice, but you could also just become more vigilant, become more aware, do your self-screenings more regularly, go for more regular checkups, have your mammograms more often, things like that, to be able to minimize the fact that if you do detect it, then it might be too late.
Yeah. All right.
So I think sometimes it could be a little bit of an over-exaggeration to have the mammogram, the mastectomies.
Yeah. Well, let's talk about or move forward on what you were saying. And Dr. Khalawan, this is where I'll bring you back into the conversation. So we've spoken a lot about the genes, and we heard Dr. Baron also talking to the fact that it's all got to do also with lifestyle and checking and all of these factors that we keep on sort of speaking about, which I think we need to speak about again. We need to constantly remind women of what they need to be doing. So talk to us about this. What is it that sort of can help us prevent, even if we are predisposed to it, but can still try and assist in our lifestyle?
So I think, as Dr. Baron has said, early screening and detection is key. So for the screening, women over the age of 20 are advised to do monthly self-breast examinations. You can do this at the same time every month, generally after the menses, and you would use the middle 3 fingers of your hand in varying pressures and varying angles on your breast, all the way from the axilla up until the collarbone, and examining your breast, looking for lumps, looking for skin changes, looking at your nipples, seeing if there's any changes there. And I think the biggest thing is look at your breasts, know them, understand them, and that's how you're going to detect a change quickly. Mm-hmm. The other thing one can do is when you go to your general practitioner or your gynecologist, ask them to examine your breasts on an annual basis. So annual breast examinations by a medical practitioner can also assist. And mammography for women over the age of 40 on an annual basis, and biannually over the age of 55 are the current guidelines that we're using.
Good. I mean, I know that some medical aids tell you, no, you can go once every 2 years, or that's what they'll pay for. And that is kind of against what you're saying, and it is important, is that the more regularly you test, the better. Is it something that, medical aids won't cover it if you're not, if you're not covered and you're going twice a year, or you're going more than once every year?
Unfortunately, yes. So I think that is the medical aids that choose that's what they're going to pay for. But I think your gene testing would come in there. So if you had an increased risk or a higher risk, according to your genetic predisposition, you may make the decision to take those extra mammographies just to safeguard yourself. So Unfortunately, yes, this is what the medical aids are saying, but there is a discrepancy with what the Cancer South Africa organization is also, the guidelines are different.
Yeah. I mean, we're talking to the privileged South Africans that have a medical aid, but a lot of South Africans are entirely dependent on public health service. And again, this proves to be a problem. And I bring up the statistics we said early on in the interview, where it was saying that, and I'd like to question these statistics and wonder what is in this, where it says data showing that breast cancer is more prevalent among white and Asian women, and the second most common cancer among black and colored women. Talk to us about these statistics and how we actually come to that in South Africa.
So there is a cancer registry that is run. So all institutions would have to relay that data into the registry. And this is how these stats come up. I think the genetic predisposition that Samantha has alluded to in certain race groups is what will lead the increased risk in the certain racial groups. However, the factors that lifestyle play in also come in. So, for example, we all know that smoking will give you an increased risk of breast cancer. Excessive weight will also increase your risk of contracting breast cancer. So both of those together, the genetic predisposition and the lifestyle factors, will allude to certain racial groups having a more increased risk of developing breast cancer in their lifetime.
Yeah. Dr. Khalawan, in terms of numbers of people that have actually decided not to go in for mammograms or go in for tests this year, obviously with COVID-19. I remember going for a mammogram this year, and I was probably one person that they'd had all day. In fact, there might have been 3 people altogether that had come in to have a mammogram because many are just scared of picking up anything. Have you also noticed that there has been a decrease with doctors' checkups, mammograms, all of these kind of things, which is going to compound the problem?
Actually, there's been about a 50 to 60% reduction in seeing patients coming into practices, and that's from across the board to general practitioners, to your oncologists who would see your cancer patients. So what they are forecasting is that in the coming year that we're going to see a lot more of advanced cancers coming in to play. So unfortunately, that early detection is very key. So we would want people to do their self-breast examinations at home if they have comorbidities, and when they feel that it's safe to go in and have their regular screening done.
Yeah. Even sometimes those self-examinations don't work because only, something like a mammogram can pick it up, and earlier than you can. So it is vital information to get forward. Dr. Baron, in terms of genetic testing, I just want to pick that up again. If people are interested in actually going the route of having a genetic test, how do you go about doing something like that?
So you could request a genetic test from your practitioner, where they could arrange with you to either test through Lancet or Ampath. And then there are certain organizations that also have tests available. So if you also go onto the Optify website, there is a breast cancer test available there as well. So there are different avenues that you can take, and your practitioner will be able to advise you correctly on which one would best suit you.
Yeah. I mean, do you recommend, obviously as a geneticist, it is something that you'd look at. I mean, are there other things that they can pick up that you are predisposed to as well? And again, we have to emphasize that it's not necessarily that you are going to get it. It is just that you are at a greater risk of getting it, and you need to be more vigilant. So I think that's an important message to get across. But they can obviously pick up quite a few things in genetic testing.
Yes, so specifically with a breast cancer test, you obviously, if you have a high risk for breast cancer, you'd automatically be put on a high risk for ovarian cancer as well as a female, or prostate cancer as a male, because mutations in these genes that we look at are actually involved in the repair process. And if this is compromised, then it makes you more vulnerable or susceptible to these cancers. Additional health tests can also pick up certain things like, are you prone to other types of cancers, insulin resistance, inflammation, things like that, cardiovascular risk. So I find that these things are quite valuable, the testing, and because prevention is better than cure. If you know your risk, you are able to do something about it.
Yeah. What about men? We haven't touched on men at all in this interview, but obviously breast cancer is much more common in women. But, in terms of cancers in men, and also the chances of men getting breast cancers as well, do you want to talk about that?
So obviously men do have a risk for breast cancer, obviously a lot lower than women. But what is really important is that when we look at these genetic tests, it not only gives a risk for breast cancer in men, but obviously prostate cancer as well. And we do know that prostate cancer is one of the most common cancers globally in men at the moment. So to be able to pick up this risk for them as well can also allow them to go for regular screenings and be sort of self-aware or elevate their own awareness of their potential risk in that regard as well.
Yeah. And then just finally, let me end it off with you, Dr. Khalawan, in terms of age. We did speak about from the age of 40, you should go for an annual checkup. After that, you should go twice a year, maybe in your 50s. But, there is a myth that younger women do not get breast cancer. Talk to us from what age you should start self-examining and looking for the signs that you're talking about.
So as you said, women from the age of 20 need to start examining their breasts ideally. And we've seen an increased risk of breast cancer in women even below the age of 35. So we need to teach our young girls that as they turn 20, the self-breast examination needs to be implemented monthly.
And diet, healthy eating, does that play a role?
Healthy,
that's a big
absolutely.
thing. Yeah,
Absolutely. The food that we're putting into our bodies now has changed. So a healthy diet, exercise is also very important. Not consuming too much of alcohol, not smoking. So lifestyle and diet are very, very important.
Ladies, thanks so much. I think we really did need to have this conversation. Long overdue. We do it all the time, but I suppose it just jogs people's memories to say, hang on, let me book. I need to go. Let me see how my status is at the moment. Dr. Samantha Baron, thank you very, very much. Dr. Yashica Khalawan talking to us about breast cancer and the fact that it is on the increase in South Africa and we need to test regularly. All right, let's take a break. Oh, no.